quite a few of my colleagues, and it seems to have been just anecdotally that it's been more of my female colleagues who have struggled through their medical training. They got through school, but they worked hard. Through their medical training, they had to work extra hard. And they still succeeded, and they've got to where they are. But at the cost of enormous effort. And so I imagine myself in their position. You're working as hard as you can, and you're just not achieving what you know you could achieve. So then you start looking at it, and if you realize, yes, it's because I've got attention deficit disorder, and you treat it, suddenly it becomes that much more easy to achieve to your potential. So all those years of underachieving takes its toll, and it leads to not usually a major depression, but a kind of dysphoria and unhappiness.
Dysphoria.
Yes.
There was
and an anxiety. Am I going to forget the next appointment? Am I going to lose it? Where am I going to find it? I'm always forgetting things. So it will increase anxiety levels, and those adult patients, if they respond to the treatment for attention deficit disorder, immediately there's an improvement in mood, decrease in anxiety, and they feel much better.
You talk about some of your colleagues. I have a client who we work online.
Yes.
She lives in another country, and she's an emergency specialist.
Mm-hmm.
And she's always, all the years, been treated for depression.
Yes.
With antidepressants.
Right.
And she went many years ago to live in another country.
Mm-hmm.
And she went for a script, or to ask about what she was taking. Should she be taking something different for depression?
Yes.
And her GP said, why don't you go and talk to a psychiatrist? She's very good.
Mm.
And my client went to a psychiatrist who said, I don't believe that you have depression.
Mm.
I believe you've got ADHD.
Yes.
My client said, horror, not me.
Yes.
She said, I've got through school, I've got through university. And she was constantly...
She's specialized,
She's constantly specializing.
Yes.
And she's in the midst of doing a huge exam at the moment.
Right.
And I'm helping her with deep muscle relaxation.
Yes.
But I never once thought that she might have an attention deficit disorder. So the psychiatrist said to her, do you struggle to find things in your kitchen cupboard?
Yes, a form there that the WHO has put out, which is a nice screening form.
Okay, because she said she was asked and she was saying yes and yes and yes.
Mm. Mm.
So the psychiatrist prescribed, and it was probably the Vyvanse.
Yes.
And she started to really focus very well.
Yeah.
It's made a huge difference. And they needed to tweak the doses.
Yes. So as I said, it's trial and error. Which form of stimulant is most effective for that patient.
Yes.
And that requires, fine titrating and personalized medicine sort of approach.
Right.
Because each person responds differently to the different medications.